So if you're interested in freezing your eggs, I want to go through what it looks like. I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. First, we want to do some testing. You'll come in, we'll do an ultrasound to look at the ovaries. And when we're looking at the ovaries, we want to do what's called an antral follicle count. I'm counting your resting eggs in the ovaries, but they sit inside of these cysts called follicles. So having cysts in your ovaries during your reproductive years is normal. And when we look at the ovaries, we count those to get an idea of how many eggs we might be able to get with an egg retrieval. So an antral follicle count is important because it helps us predict your success with egg freezing. Once we do that, we're going to do some hormone levels. And the hormones that we're testing include AMH, which stands for anti-Müllerian hormone, FSH, which stands for follicle stimulating hormone, and estradiol. In addition, we'll do some other hormones that are intended to make sure that it's safe for you to go through the procedure, and then some hormones that might interfere with your fertility hormones. So once those tests are done, we'll start the process if you're a candidate. And that process involves about 2 weeks of taking injection medications, anywhere from 2 to 3 injections per day, and of course we'll teach you how to do those injections. Those injections are tiny needles that go in your fat tissue, so we'll teach you how to do those in the belly fat or the thigh fat, and you'll be coming in roughly 5 to 7 times during those 2 weeks for pelvic ultrasound and blood tests. The blood tests are done to assess your hormone levels to determine when's the best time to go and extract the eggs from the ovaries. When I go to take the eggs out, we're doing it through a small needle that I pass through the back of the vagina, and I'm using an ultrasound to guide me into the ovaries to take the eggs out of the ovaries. During that procedure, of course, you're going to be under anesthesia, so you won't remember any of it. It takes me about 30 minutes to get the eggs out. All in all, you'll be at the surgery center for about 1 to 2 hours, involving the pre-op, check-in, procedure, and checkout. You want to have a chaperone that day. You want to make sure that you have someone stay with you that day. And typically people can work the next day, but you definitely want to take it easy over the next few days. I would say you're probably going to have most of your bloating and your symptoms peak somewhere between 3 to 5 days after the procedure, and most people feel like they start to resolve about 5 to 7 days afterwards. A lot of times patients come to me when they're at that age of 35 thinking that's kind of the magic number when everything falls apart with fertility. But the reality is fertility is best in our 20s, and it really starts to decline as early as our early 30s, and 35 is not this magic number. It comes from really old data. So we don't know who's infertile until they try to get pregnant. There's certainly some red flags we might get from testing, and so 1 in 6 do struggle with infertility. Until you try to get pregnant, we don't know who you are. So if you have the opportunity to freeze sooner, I would suggest at least consider it, and do some testing if you're going to delay childbearing. The other thing I always talk to my patients about is freezing eggs is really a good option, and it gets you some opportunity for future fertility, but it's no guarantee. And until you go to use those eggs, it's impossible to know if those eggs are going to result in healthy embryos. So if you are thinking about ever using a sperm donor, you might want to consider freezing embryos, and that's an option that people don't think about necessarily. If you're in a relationship and you know this is your partner, you might consider freezing some embryos, maybe not only embryos, maybe some eggs and some embryos. And certainly at some point, if you've frozen eggs and you meet someone but you're not ready to be pregnant yet, you can thaw and fertilize some of the eggs, or you could go through another cycle and freeze embryos, even if you're not ready to carry that pregnancy at that point. We don't want you to have waited until you're so much older that if those eggs don't result in what you were thinking they were going to result in, you're too old to go back and do treatment. So don't wait till you're 40, 45 to use those eggs, because they're not a guarantee.